Let's continue on Columbia Morning. We're having a conversation that will come in handy, I think, for many of us, because what if we need to see a doctor or physician and we're not going because of any symptoms of coronavirus? We're not thinking that is what is most important for us in our health care. Maybe something else. Are we going to be able to see a physician? Are we going to be able to go to the office? When should we and when should we not plan on doing that? We're going to get some answers right now. Dr. Michael LeFevre is the chairman of the MU School of Medicine, Department of Family Medicine, and he joins us. Dr. LeFevre, good morning. How are you today, sir?
I'm doing very well, thank you.
So what is the basic advice that you would give to us? Because some of us might have a screening that's due now. We might have something else going on. What's the best advice for us?
Well, I think the important thing to remember is that the COVID threat that sits on top of us right now is just an addition to our existing healthcare needs, and it doesn't replace all of those healthcare needs. Those still exist. And certainly from our perspective, the health and safety of our patients, our staff, and our providers is foremost in our planning and the way we're trying to reorganize care to make it safe for people who need to get that care. So I think right now, people should not postpone necessary care. I think that's the most important thing. We're doing several things to try to keep it safe for those things to happen. Number one, probably most importantly, has been the rapid expansion of video visits or telemedicine. We're doing things today that 2 months ago would have been against federal regulations, but they relaxed those regulations. And so we're taking care of a lot of people in their homes via video visits. Within the course of about a week, in family medicine, that moved to about half of all of our visits are now done by video. We, of course, want to keep our waiting rooms safe, and we want to keep people who shouldn't be there out and people who need to be there in. We're triaging respiratory symptoms by phone before people ever come. Anybody who we feel is in need of testing for the COVID virus is, if it's safe for them, go through the drive-through screening, which is over behind Hearns. Anybody that seems to be in any trouble at all goes straight to the emergency room. And most respiratory infections, honestly, don't meet either of those criteria and can be managed at home pretty safely, and including a self-quarantine until you start to get better. That keeps sick people out.
I understand that. I think this is good advice, and that's the basic advice. Let me ask you this. If somebody is going to do something by telemedicine, you said the rules have changed, so now I would not need to go to another place in order to hook up to a HIPAA-secure system. I would be able to do this through standard apps or other ways that many of us are communicating with loved ones right now?
Absolutely. And as a matter of fact, MU Healthcare is using the Zoom platform, the same platform that many school systems and universities are using to teach students and so forth. The only requirement on the patient end to do video is that they have to have a smartphone, tablet, computer, some sort of video access, and a decent wireless connection. But that puts most people still in play. And we simply send them an invitation. They, at the appropriate time, open their Zoom app on their cell phone and click on the visit, and we're communicating face-to-face.
What works best for telemedicine? In other words, I don't mean the system. I mean, what situations as far as health-wise are best handled this way, and what would be the most complicated one that you could possibly handle through this kind of remote diagnosing and treatment?
Well, I think there's two things to consider there. One, obviously, we're not doing much of a physical exam, so if it's important for the management of a particular problem to have a good physical exam, then that's not going to work well from a video standpoint. For example, if somebody's having abdominal pain, examining them is going to be an important piece of that evaluation, and we're not going to be able to manage that via Zoom. On the other hand, many chronic medical problems can be managed this way. Diabetes, high blood pressure are two good examples. We're mostly evaluating data when we do that. And people have home blood pressure cuffs, and and we learn more from what their blood pressure is at home than we do when it's in the office, quite honestly. And so we can talk, chat, see how they're doing with their medications, find out if they have any important symptoms we would be worried about, find out what their blood pressure is doing at home, and say, sounds good, send them a refill, and see you in 6 months. So chronic medical problems are certainly good. Rashes, honestly, can be managed pretty well over video. Sometimes a photo is a little bit better than the video link itself, but our technology allows people who have access to our portal, which is a pretty high penetration for us, can just take a picture and send it in, and we can look at it right there in their medical record, and then chat with them on the phone about what we think.
It might be hard for a physician to know how many people are saying, you know what, I'll just put this off for a little while longer. I know I'm due for this screening, or I know I'm due for this shot, or I know I may be due for something else, and put it off. Please address that and how safe or unsafe, wise or unwise that is.
You know, I think when people are well and they have no chronic medical problems, and they're talking about putting off some sort of screening for 2 or 3 months, there's probably minimal risk associated with that. I would say the people that we worry the most about are the people who are managing chronic illness, and we don't want them to stay home and get sicker. Then they end up in the hospital, and that's the last place they need to be right now. So I think that for people who have any sort of ongoing health concerns, my advice is don't delay. We can take care of you, and we can take care of you safely. And for many of you, that will be a video visit.
I'll say this. Some insurance plans that companies have given to their employees request a physical by a certain time in order to continue to get a certain plan. Physicals, you could probably delay, and hopefully the companies and the insurance companies that are covering for these corporations will understand that also. Your comment?
We certainly hope that to be the case, but on the other hand, if it's important to the patient, we can certainly see them in clinic, and it's safe to do so. Waiting rooms, to be perfectly frank, are pretty sparse these days because of the proportion of people who have canceled and another significant proportion who are going to video visits. You show up at the front door. You asked respiratory questions, your temperature is taken. You go in and sit down very briefly, quite frankly. The waiting rooms are all socially distanced so that you're not sitting right on top of each other, and you spend very little time there. And then you're in the exam room being taken care of. So we can see people who need to be seen, and it's safe.
Let me ask you this before I let you go. What will this mean for the future of this kind of medicine? Probably used, if it's done well now, it may mean that in the future we'd be able to have more of this.
I would be surprised if we put this genie back in the bottle. It'll be interesting to see how the regulatory environment responds. You know, right now, the relaxation on the regulatory side is designed to be temporary, but I think that there would be a public outcry, quite honestly, from both the healthcare providers as well as the patients that say, this worked, why would you take this away from us? So I suspect this is a part of our future indefinitely.
Anything else that we've missed that you wanted to stress before I let you go, sir?
No, I'd just like to emphasize again that the health and safety of our patients, staff, and providers is the key thing that we're working on right now, and don't delay necessary care.
Very good. Communicate with your physician, listeners. That's basically the message here. And those they'll be wise to say what we can do, what they can do remotely, and what they would need to see you for. Dr. LeFevre, thank you so much.
Thank you so much. Appreciate the chance.
Thank you. Dr. Michael LeFevre. He's the chairman of the MU School of Medicine, Department of Family Medicine, also a family medicine physician who is putting into place some of what he's just said and what he's advised us to keep in mind when we need necessary health care. It's still important for you to check with your physician and contact your physician. They are still seeing patients either through a video hookup or in person in the offices. This is Columbia Morning at KFRU.